Good morning. My name is Liza Hirsch. I'm a staff attorney at Medical Legal Partnership Boston, and I'm the attorney liaison to Boston Children's Hospital. I'm going to be reading the testimony of Sally Cheek, who's a social work manager at Children's Hospital Primary Care Center. My name is Sally Cheek. I'm a social work manager at Primary Care at Boston Children's Hospital, a clinic that serves approximately 14,000 children, 70 to 80% of whom are from low-income families. I'm testifying here today regarding the changes I've observed in the volume and experiences of homeless families reporting to our clinic since the new emergency assistance regulations went into effect in early August 2012. I'm also representing the broader social work department at Boston Children's Hospital, including the emergency department. Over the past 7 years working as a social work manager at Children's Hospital Primary Care, homeless families in our clinic have faced significant challenges accessing shelter and affordable housing. Yet I have never seen families in such dire circumstances as I've witnessed over the past 2.5 months. Since August, many more families have reported to our clinic after having been denied EA shelter with nowhere to stay that night. Families have slept with their children in cars. Other families have stayed overnight in the children's emergency room. Many others are staying in crowded, stressful, and unsustainable double-deck situations. These families were all deemed ineligible for emergency assistance shelter. I have spent many hours calling Travelers Aid, the mayor's hotline, and every private shelter I can find, only to be told that all of the private shelters are full. The families that come into our clinic are at the end of their rope. Mothers come in upset and crying because they've been denied shelter and have nowhere to turn. The changes in shelter eligibility have taken an incalculable toll on the children in these families, who absorb the stress of their mothers as they struggle to find the next couch or next floor their child will sleep on. Additionally, these regulations have taken a toll on the social workers in primary care and in the emergency room. Our department collected data of the number of homeless families who have reported to social work across the hospital before and after the new EA regulations went into effect. The number of social work hours devoted to homeless families at Children's has doubled since June. From May 13th to June 24th, there were 44 social work encounters in the hospital pertaining to homelessness and 47 hours spent on homelessness. Since the regulations went into effect on August 6th, there has been a significant increase, particularly in the number of hours spent by social workers handling homelessness crises. From August 6th through September 16th, there were 74 homelessness encounters and 115 hours spent by social workers. Given the high volume of families our social workers must serve, we simply cannot sustain this level of intense time commitment to helping families find a place to sleep when the state shelter system has failed them. DHEB's current policies are coming at a tremendous cost to families and starting to strain the medical system. When families who've been denied EA shelter have no place to stay and we can't get them to private shelter, we've actually had to advise them to sleep in the emergency room so that they don't have to sleep outside with their children. This is an unacceptable and costly way to manage family homelessness. Emergency rooms, cars, and other low-income